we are covering preferred provider organizations, known as PPOs, a major topic on the health insurance licensing exam. The exam will test your understanding of how PPOs operate, especially in contrast to HMOs. A key feature of a PPO is its network of preferred providers. These are doctors, hospitals, and other healthcare providers that have contracted with the insurer to provide services at a discounted rate. When a member uses one of these in-network providers, they receive the highest level of benefits and pay less out of pocket. For example, an in-network office visit might have a $20 copay. The most significant distinction for a PPO, and a frequent point of comparison on the exam, is the ability for members to receive care outside of the network. If a member chooses to see an out-of-network provider, the PPO plan will still provide coverage, but the member's cost sharing will be higher. That same office visit to an out-of-network doctor might require the member to pay 40% of the cost, a concept known as coinsurance, after meeting a separate, often higher, out-of-network deductible. The exam often presents scenarios where a client wants flexibility and the choice to see any doctor. This is a dead giveaway for a PPO. Unlike an HMO, a PPO does not require members to choose a primary care physician, or PCP. Furthermore, and this is a critical point for the exam, PPOs do not require referrals to see a specialist. A member can self-refer to any specialist they choose, whether in-network or out-of-network. This freedom of choice is a hallmark of the PPO model. A common exam trap involves confusing the roles of a PCP in different plans. While an HMO uses the PCP as a gatekeeper who must provide referrals for specialist care, a PPO has no such gatekeeper requirement. Be prepared for questions that describe a patient's needs and ask you to identify the most suitable plan. If the question emphasizes choice, freedom to see specialists without permission, and coverage for out-of-network providers, the answer is almost always a PPO. A great way to remember the core concept is the mnemonic PPO means pick your provider, pay your portion. This highlights the flexibility to choose any provider, but reminds you that going out-of-network will result in a higher out-of-pocket cost. The trade-off for the flexibility offered by a PPO is typically a higher monthly premium compared to more restrictive plans like HMOs. The exam will expect you to understand this relationship between flexibility and cost. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.